Welcome to everyone who is here and who's attending. We're really glad you've joined us, and you're hoping you're having a great conference at AAAS. We had a really very interesting presentation this morning on human rights education, and I'm thinking that there are several threads that were presented earlier this morning we will likely be able to carry throughout this workshop as well. So thank you again for being here. My name is Neil Rubin, and I'm the moderator for this session. I'm joining you from Evanston, Illinois, which is on the ancestral lands of the Three Fires Council, the Ojibwa, the Ottawa, and the Potawatomi peoples. I am a professor at Ottawa University in Chicago. I have served on the American Psychological Association's United Nations NGO team for some time. I currently chair the Committee on Scientific Freedom and Responsibility in the Scientific Responsibility and Human Rights Program at AAAS, and recently co-editor of an award-winning book with my colleague, Dr. Flores, who you will meet shortly. And all of the speakers are contributors to the book by Cambridge. It's called The Handbook of Psychology and Human Rights. I was going to, rather than editor, I was going to say parent, because it feels like we have birthed something with all the pain that goes with it, but I'll leave that idea for now. Our topic today is Building Back Better Everywhere, Health Inequities, Sustainable Development, and the Human Right to Science. So according to the UN Secretary General, Antonio Guterres, inequality has become the defining quality of the 21st century, with the COVID-19 pandemic laying bare how unequal we are within and between countries. The challenges before humanity in the COVID-19 pandemic range dramatically from the opportunity to advance health science for the benefit of all, to the risk of replicating the inequities in human health and well-being that have existed globally prior to the pandemic. New technologies and the creation of vaccines and cures capture the ingenuity and promise that science offers us. At the same time, access to these advancements continues to be plagued by political, social, and economic systems that undermine success in curbing the spread of disease and promoting historic inequities. Now, the world community has envisioned frameworks to engage these challenges. At the United Nations, this world body has created the 2030 Agenda on Sustainable Development, in which 193 nations of the world have committed themselves to achieving significant advancements over the next decade. These goals are well integrated with scientific and technological advancements. Sustainable Development Goal number 3, for example, requires nations to achieve specific targets regarding the health and well-being of their populations, and SDG 10 to reduce the inequalities within and among countries. These goals dovetail well with human rights generally and the human right to science in particular. The International Covenant on Economic, Social, and Cultural Rights in Article 15 states that the states parties to the present covenant recognize the rights of everyone to enjoy the benefits of science, scientific progress, and its applications. Therefore, governments, the private sector, civil society, are all expected to address and take specific steps to ameliorate health inequities, both consistent with the SDGs as well as to their commitments to fundamental human rights. The failure to do so then violates human rights, undermines aspirations of the human community, and prevents scientific progress to eliminate devastating disease. The gap between creating the science and accessing the science worldwide remains profound. Among the sciences, social science has much to offer to understand and respond to the needs of marginalized communities. In this workshop, we have representatives of 4 communities who will articulate the discrimination in each of their communities with respect to health inequities and propose social science responses that have the promise of affecting those inequities. Psychologists working with and representing indigenous communities, the African diaspora, the disability community, and refugees and immigrants will speak to you regarding each of these communities. Following these 4 talks, We want to hear from you based on your expertise. So we will create breakout groups with key questions in which we want to have the discussion lead to actionable items that can be brought to bear so that we might have success with what the Secretary General has envisioned to build back better everywhere. So again, thank you for being with us. I have the honor of introducing our speakers, and I'm going to now go ahead and introduce our first speaker, who is Art Bloom. Art is an American Indigenous psychologist, professor of clinical psychology at Washington State University, has many honors. He's honored with the Joseph E. Trimble and Jewel E. Horvath Award for distinguished contributions to Native and Indigenous psychology. He's been a Rockefeller Foundation academic writing fellow, a president's professor at the University of Alaska Fairbanks Center for Alaskan Native Health Research. He's an APA fellow, a past president of Division 45, and a past president of the Society of Indian Psychologists. Dr. Bloom has published extensively on the topic of Indigenous psychology, including the recent book, A New Psychology Based on Community, Equality, and Care of the Earth, an Indigenous American Perspective from Prager, and the soon-to-be published Colonialism and the COVID-19 Pandemic, Perspectives from Indigenous Psychology from Springer Nature. Art, you have the virtual floor.
Thank you, Neil. I hope I don't blow it because of my technological lack of savviness. But good morning, good afternoon, and good evening to everyone. It's nice to see you all, and thank you for joining us today. I'm going to try to share my screen. Okay.
You got it, Art.
All right, beautiful. Okay. So good morning again. I'm going to be speaking to you from an Indigenous perspective on how to build back better. That both addresses the need for sustainable development and accessible science. To understand where we are, some reason. There, okay, I'll just do it this way. It's not coming up. So to understand where we are, we must look to colonial history. The doctrines that were established by European leaders laid the foundation for social hierarchies and therefore inequities. I mean, you can look at the various doctrines that were included in these documents, and you can see that superiority was assumed, and for the people who are conquering and the people who were already indigenous to the areas that were being conquered were considered to be inferior people with inferior cultures. And these particular documents also made it such that the lands became consumable items by those who conquered the indigenous people in those areas. Those hierarchies made it possible for some people to be entitled and privileged and others to be discarded. In addition to that, the hierarchies that were assumed by the conquering cultures also contributed to a concept of exploiting the environment that has contributed to widespread environmental degradation and global climate change as well. So the consequences of colonization are pretty well known. But what I've done here is actually link the consequences of colonization to potential barriers to reaching the sustainable developmental goals that were adopted by so many countries. So for example, you can see that consequences included health inequities, education inequities, wealth and income inequities, sickness, lack of psychological and physical wellness, and exploitation of resources, and racism, which was permitted as something that was in support of the idea of superior people over inferior people. And all of these consequences have been associated with hierarchical assumptions and have been related to pursuing colonial self-interest over time. So these particular, background information and data contributed to Indigenous people and others as well at being at particular risk for the COVID-19 pandemic. You can see the data that, pretty recent data from this summer in the United States as to what was going on with Indigenous people. To begin with, we step back for a moment and take a look at, what were the conditions pre-pandemic, and you can see as of 2019 that Indigenous people in the US had very high poverty rates, pretty high unemployment rates for the United States at that time, and very high uninsurance rates. And in the context of being exposed to the virus, this was particularly devastating and left the people very vulnerable. And you can see in the lower part of the slide, you can see how the COVID-19 pandemic has impacted Indigenous communities, where there are clear disparities in the number of cases, in the number of hospitalizations, and in the mortality rates. Such that the loss of expected years of life have been tremendous for Indigenous people in the United States. And, this is not just, something that hit the Indigenous community alone. It hit a variety of particular outgroups in American society. Those groups that were initially, conceptualized as being inferior groups, therefore, were treated differentially. So from an Indigenous perspective, it's really clear to those of us who think this way that the tremendous barriers to sustainable development goals and to accessibility of science to these particular populations is related to these assumptions of hierarchy. And the assumptions of hierarchy have contributed to a very self-focused society with a really a preeminent view of self-orientation and self-interest being an important construct within these particular societies. So pursuing self-interest has been at the heart of these problems. It's at the heart of the barriers to us achieving sustainable development and to achieving equal access of science for all. Then hierarchical belief systems have contributed naturally to valuing self over other people. And from the perspective of those who are privileged in society, that means there are haves and then there are significant numbers of have-nots in those societies. And you can see the various ways that self-interest created problems during the pandemic. To begin with, the environmental degradation globally has placed health at risk for all people. And research overshoot has encouraged encroachment that has contributed to potential exposure to novel viruses. And in terms of what happened in the United States in particular, libertarian ideals were winning over social responsibility in ways where the pandemic was not being addressed properly. And globally, we see that vaccine nationalism and the now the experience of promoting boosters is taking away from equity globally in terms of vaccination privilege. And there have been numerous instances in which people were allowed to go to the front of the line and get vaccines that they weren't necessarily qualified to receive, and that certain people receive treatment that was certainly privileged. And then finally, the conspiracies and the defiance that occurred are, results of manipulators in these societies that are promoting an agenda that tends to support supremacy and superiority perspectives. The interesting thing from an Indigenous point of view is that the scientific evidence that abounds is not necessarily supporting these assumptions in colonial societies. For example, the idea that there are natural hierarchies in nature are not supported by life sciences, for example. And hierarchies are certainly not functional when you consider that we live in an interdependent world where things that happen to the rest of the planet are certainly going to impact the health and psychological well-being of human beings. And the pandemic really exposed the fallacies related to hierarchical thinking, with Exhibit A being that the power that the tiny viruses have had over human creatures, exposing the belief of apex creatures as being fundamentally flawed. From an Indigenous perspective, what we believe to be true is that people and creatures are egalitarian co-participants in the natural order, that predator and prey are equally vulnerable in their symbiotic relationships within the natural order. And so Indigenous people don't conceptualize of apex creatures at all, that we are partners in dwelling in this very small world that we live upon. And evidence also tends to refute the ideas of self and autonomy, where people were originally thinking that there were very distinct boundaries between self and others. We know that the skin that surrounds our body is permeable, and that we're constantly exchanging molecules with the world such that ourselves are dynamic. And we know from life sciences that we really exist as a colony of organisms that must work together in symbiosis to be healthy creatures. And then finally, life sciences shows extensive evidence that the world is interdependent rather than independent. And so within psychology, as an example, the focus on independence and autonomy as evidence of healthy psychological function and wellness seems to have been a deviation from what life sciences shows us to be true about the assumptions of the natural world. And so I include a different way to look at the world on the last slide in my presentation. And it shows the differences between the assumptions of the mainstream and the assumptions of Indigenous people, for example. Essential assumptions that show that, rather than thinking about our existence on this planet as something that's adversarial and competitive, we should be thinking of it as interconnected and collaboratively working together. That hierarchy actually has contributed to the challenges we see in attaining sustainability. And that in reality, if we were to fully embrace the interdependence of our existence, it would change fundamentally the way we operate in terms of equity in society and in terms of our science. So from an Indigenous perspective, if we're to build back better post-pandemic, we need different assumptions. Rather than self and self-interest to guide the social orders. We might want to view the scientific evidence and utilize that and align with that evidence that in reality, our planetary existence is interdependent and therefore egalitarian in nature. And to act otherwise is to create the difficulties that interfere with sustainability and equity. So in reality, hopefully we're looking to the future in seeking holistic planetary wellness. It's the best hope that we have for making our science accessible to benefit all by decolonizing our science in a way that aligns with our own research. So thank you for that time. And I will turn it over to our next speaker.
Well, Art, before I let you go, first of all, thank you for that really fascinating and challenging discussion. I feel very challenged by what you said. There was a quick question, though, in the chat for you. I don't know if you'll know this. Dr. Kendall, one of our participants, is asking regarding some of the data you presented on the prevalence rates earlier in your presentation, whether it was per 100,000.
Yeah, actually, yes, they've been standardized to go across groups. So yes, it was the rates rather than the actual numbers. Yeah.
Okay, thank you. Did you have something else you wanted to say about it?
No, I'm trying to
undo
my share. There we go.
All right. Well, while you're doing that, I'm going to introduce Roseanne Flores, who is our second speaker and who's professor in the Department of Psychology at Hunter College at the City University of New York and a faculty member at the Roosevelt House Human Rights Program in New York City. She's a developmental psychologist by training and was a National Head Start Fellow in the Office of Head Start in DC, and subsequently has worked at the Institute of Education Science in the National Center for Education Research, creating templates for the dissemination of assessments developed from research in the field. In addition, she has been involved in the Race to the Top Early Learning Challenge grant. She's currently serving as a member of the Committee on Children, Youth, and Families at the American Psychological Association. She has been deeply devoted to the APA's United Nations NGO team for some years now. And she is with me, co-editor of the Cambridge Handbook of Psychology and Human Rights. Dr. Flores, you have the virtual floor.
Great, so let me share my slides now. See if I can do that as gracefully as Art. All righty, you all can see them.
Yes.
Right, great. All right, so I'm gonna build a little bit on Art's conversation about people who were sort of disenfranchised during the COVID pandemic, but also building on some previous history around that. So this topic today will look at environmental justice, climate change, and people of African descent. So I want to start off first by looking at the Universal Declaration of Human Rights and talking about two of them in particular that are relevant to this conversation today. And the first one is Article 3 that says everyone has the right to life, liberty, and the security of person. And Article 25, the first point of it, which says everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, which includes food, clothing, housing, and medical care, and the necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, and the lack of a livelihood in the circumstances beyond his or her control. And so these rights are going to sort of frame the conversation that I want to have with you all today. We start off by looking at the work of the working group of experts of people of African descent. And these group of experts were formed by the Commission on Human Rights in 2002 to really address globally the rights of all peoples of African descent. And what I'm going to talk about today is really based on the working group in its current capacity and looking at where we are with COVID. And what we know is that in addition to the COVID-19 pandemic, the climate crisis has also disproportionately impacted the rights of people of African descent. So we want to address, well, why might that have occurred, and think about it in the context of environmental racism. And what might that environmental racism mean? And so overall, it's been defined as a disproportionate effect of environmental hazards on people of color. And I purposely chose the images that you're seeing here, because in a second, what you're going to see and what I'm going to talk about is that, in fact, people of color, more often than not, live in communities where, in fact, they are surrounded by these types of hazards. So we're going to think about contaminated water, air pollution, lead poisoning, and then exposure to toxic waste and industrial facilities. We look at environmental injustice, and I'm saying I framed it that work as opposed to justice and people of African descent. And what we see is that we have this exposure to environmental toxins, the lack of access to clean air and water, and an inadequate enforcement of environmental regulations, which is one of those things that is key. And that is due to the historical and structural racism that has been historically tied to the policies and practices that have affected the lives of people of African descent. So more often than not, folks who are in these communities are short on amenities, but high on risks. In the context of that, I want to link environmental justice to health, right? Because they actually go hand in hand. So when we think about that, we can think about those social determinants of health, which were first defined by the World Health Organizations. And these are those non-medical factors that influence health outcomes. So of course, we can think about things like food insecurity, access to housing and community risk and amenities, education, access to decent work, access to high quality health care, and then environments. And so these things go together. They're not separate, and we sort of have to think about that in terms of how it affects the overall health and well-being of people of African descent. You also want to link health disparities to environmental justice. And so what we know. So those social determinants of health, those environmental factors, can lead to those poor health outcomes of individuals who are disproportionately living in communities burdened by social inequities and environmental hazards. So in this image, and some of you may have seen this before, we see the effects of climate and climate change and the climate crisis on the health of individuals and communities, because individuals obviously are embedded in neighborhood and larger communities that are affected by these policies. You can also think about it somewhat as of a bioecological model, right? And so we know that it's going to affect physical and mental health, as well as community health. I'm going to focus a little bit on the mental health and talk about that later. So we're going to see things like stress and anxiety and depression and grief and a sense of loss. And we know that during the COVID pandemic, we have seen spikes in all of that. Think about it from the American Psychological Association's report on stress in America. These are some of the results that have been presented there. We see a strain on social relationships. So it's not only just the individual, that's the relationship between those individuals and the communities and their families, right? So then if you think about even children in this context, what you see in this image, our children have sort of been suffering because they've been out of school. But they've also been impacted by the fact that maybe their parents or grandparents have died and or lost work. And so that's also affected their well-being. We've seen a spike in substance abuse. We've also seen an increase in violence, and in particular, gender-based violence. And then again, folks are suffering from post-traumatic stress disorder as a result of that. And then clearly that's linked with community health. So what I wanted to do today is really take a look at the communities that have been affected by this and then focus in particular on one in New York City. So I am in New York City as I'm having this conversation with you now. So the first image you see is actually the New York City subway. And this happened in September 2nd, when Hurricane Ida hit the city, and within seconds and minutes, the system was flooded. And of course, we had been hit before by Hurricane Sandy, but those were on the outer skirts of the city, right? The city proper, the state proper. This time it was on the inner city. The next image next to it is Somalia, right? Because this is a global issue, it's not just local. And there in Somalia, what you see is the effect of drought and deforestation, which is clearly having an effect on the livelihoods of people there and their health and well-being. Third picture down on the left-hand side, you see is Louisiana. And that's after Hurricane Ida. But we know that Louisiana had been hit before by hurricanes and had not been able to build back better from the previous hurricanes. And so that also has affected the health and well-being, particularly of people of African descent within those communities. And finally, the last picture to your right is from Flint, Michigan. And Flint, we know, has been in the headlines because of the lead in the water that has affected the well-being and lives of children at the physical level. We know that there will be long-term consequences, particularly around brain development. And then how will that play itself out into long-term life care across the lifespan, right? But today, I'm going to focus on a place in New York City. And the place in New York City is South Ozone Park in Queens. Because as of our last pandemic, which happened, it seems a long time ago, but we do pandemics, the last hurricane that we had, Ida, that was September 2nd. And as I referenced before, the water came down in flood proportions in a very quick time. But South Ozone Park, Queens had been surrounded by problems prior to this hurricane. So in November of 2020, a 42-inch pipe burst and crumbled, and raw sewage flooded into the homes of 74 residents in South Ozone, Queens. And this is in New York. And again, you'll see later on when I start to talk a little bit about the data, this is a diverse community, but it's highly African-American. So what we see is that about 30% identify as African-American, 7% are Asian, and 24% Hispanic. And 54% identify as having at least a high school diploma or less, with 1 in 5 adults not having completed a high school diploma. In that community, we see that homes have several maintenance problems, such as mice and rats and peeling paints and water leaks and cracks. We see that the income level there between individuals 16 and older are unemployment, and 59% of the residents there spend about 30% of their monthly gross income on their rent. Right? So when we start to think about housing insecurity, we start to have that conversation there. You know that 1 in 5 adults there lack access to health insurance. And 11 of them out of that go without care, right? Go without treatment. So again, if you're thinking of that in the context of the COVID pandemic and who had access and who did not have access initially, lots of people aren't even going to seek medical treatment because then they thought that they didn't have healthcare insurance, right? And then the leading causes of death there, right, just as in New York, are a high rate of diabetes, liver disease, accidents, and Alzheimer's disease. But those numbers for the groups living in South Ozone Park tend to be higher than the numbers in New York City as well. But if you look on the right-hand side, what you'll also start to see is the level of toxins and hazards in this community. And so there you see 37 tanks and spills that can be found in this particular area of Queens, right? So you have underground storage, above storage tanks, linking underground storage, potential hazardous spills, and hazardous sites. You can also see that here in South Ozone Park, 1 out of 6 individuals has been diagnosed with COVID. And a smaller portion has been vaccinated. So it's around, I think it's around 74% has been vaccinated, which is lower than all of Queens, New York, but it's approximately the same as it is across the city. Right? So here what you're seeing is you have all of these climate issues going on, you also have climate issues around COVID. So what happened with Ida? Well, as you probably heard in the news, or you read, or you listened to, Ida devastated Queens. It's one of the hardest hit areas in New York City. And 12 people died. And many houses and homes were destroyed, as well as businesses. Many individuals there don't carry flood insurance, and they didn't have it in the past. But if they're going to receive monies from FEMA going forward, they're going to have access to flood insurance, right? So again, if you're thinking about that in particular, that community, what you see is that, you know, if they're paying 30% of their income for rent, some of them are highly unemployed, they're not probably going to have access to be able to pay for these new types of insurances, these flood insurances. So just like access to healthcare and health insurance, they're going to go without, right? For others, if they choose to pay these premiums, that's going to impact whether they put food on the table or gas in their car, which they need for many of them to get to work. We also know that there have been psychological impacts on these folks, as raised before, in terms of mental health. And so in addition to what we've seen with COVID, which was the increase in stress and anxiety and depression, we also see that we have an increase in stress and anxiety, depression, because people have been hit now by Hurricane Ida, and they have also lost their homes and have no place to stay. So therefore, climate change is also having an impact not only on the mental health and well-being of individuals because of the climate, but also the intersectionality with the other things that are going on in people's communities. So in particular, if we focus on Sustainable Development Goal 13, which is climate action, and we look at one of the targets, the goal here is to strengthen resilience and adaptive capacity to climate-related disasters. And so here, this is where we need to think about the intersectionality between our science and what we know, and in terms of our physical science, and also our public health and health sciences, and how they relate to people, and in this case, in particular, people of African descent. So the recommendations that have been made from the working group of experts, and this happened at the very beginning of the year, so it's relevant to hear what we're talking about, is that the policies enacted across the world have caused people of African descent, just as we've heard before with marginalized folks, to live in communities with exposures to high levels of environmental hazards, which in turn have led to high rates of disease such as asthma, cancer, hypertension, stress, and other chronic illnesses. In order to build back better from COVID-19 and address the impact of climate change on the people of African descent, the working group of experts recommends that a human rights approach be taken to address the needs of vulnerable communities impacted by the crisis. Furthermore, the committee calls for people of African descent to be present at all stages of the process, which includes preparedness, mitigation, response, and adaptation. And as I was listening earlier this week to another panelist talk, for some, it is not only mitigation because people have started to adapt. So we need to have that conversation about these communities as they adapt to the new normal. And finally, where I end is today, or recently, just relatively recent, weeks ago, for the first time, the United Nations Council in Geneva passed a resolution that recognized access to a healthy and sustainable environment as a universal right. And so as we think about going forward and building back better, we need to think about it in the context of this new resolution. So although the resolution is non-binding, it serves as a catalyst for governments to make commitments legally and financially to ensure that everyone has a right to life, health, liberty, and peace and security. With that, I will stop there.
Okay, thank you, Roseanne, so much. And thank you for these connections between sustainable development, the social determinants of health and mental health, and climate justice, and in particular, climate injustice, which is so much of what you've underscored here. We really appreciate those connections and the way in which you've elaborated for us. I'm going to now introduce our next speaker, Jyn Hashimoto, who is a PhD candidate at Kanazawa University, as well as an assistant director at the Ministry of Foreign Affairs in Japan. He is speaking with us from Tokyo, where I believe it's Saturday morning at this point. After joining the ministry, he was posted in various positions, including the Embassy of Japan in Uganda, where he studied implementation of mental health and psychosocial support in refugee settlements. He previously worked in a substance abuse treatment center for individuals suffering from homelessness and poverty in New York, and also supported the work of the United Nations International Institute for Global Health. And Jyn is the first author of a chapter, Human Rights of Persons with Disabilities, Convention on the Rights of Persons with Disabilities, and its nexus with mental health and psychological well-being in the Cambridge Handbook of Psychology and Human Rights. Jyn, thank you for staying up so late on a Friday night and Saturday morning, and we look forward to hearing from you.
Thank you, thank you. Let me share my slides. I'm hoping that now everybody is seeing my slides. Yes?
Yes.
Okay, good, good. So thank you, Dr. Rubin, for your introduction. It is past midnight, but I'm really energized and excited to be with the experts of marginalized communities. I guess my role today is to introduce disability perspective in the context of human rights and sustainable development goals. I want to start the slideshow. Okay, good. So this is my outline today, and let me first discuss the definition of persons with disabilities and its population size. So according to the Convention on the Rights of Persons with Disabilities, persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. So I'm going to come back to this point later, but I just wanted to stress that it is the interaction between impairments and barriers, not just the impairments alone. And in terms of its population size, approximately 15% of the world's population, which is 1 billion people, lives with some form of disability according to WHO and the World Bank. So the number is not small, but they still face various forms of human rights violations and continue to be marginalized. And what is particularly relevant to the today's COVID-19 pandemic is the challenges of persons with disabilities in the context of health. And recently in 2019, the United Nations published a flagship report on disability and sustainable development. And this really explains well the challenges which persons with disabilities struggle with. So they are more likely to have poor health in comparison with persons without disabilities in general. And access to healthcare services remains to be a huge challenge for persons with disabilities who are more than 3 times as likely to be unable to get healthcare when they really need it. And in terms of access to rehabilitation services, in some countries, more than 50%, surprisingly, of persons with disabilities have an unmet need for these services. Further, the lack of financial resources, lack of access to and accessibility of medical facilities and transport, in addition to inadequate training of health personnel to accommodate special needs of persons with disabilities remain to be a serious issue. And if we are to support persons with disabilities, especially in this COVID-19 pandemic, we really need to address the health challenges faced by persons with disabilities. And I just spoke about, challenges and obstacles faced by persons with disabilities, but it doesn't necessarily mean that the international community just remained silent. The international community did make some important steps forward and advancements in the field of disability. And I'd like to touch upon core international frameworks such as Convention on the Rights of Persons with Disabilities and SDGs. So let me start with CRPD. The convention was adopted by UN General Assembly in 2006. And through this convention, protecting and promoting the rights of persons with disabilities and monitoring the implementation became a global priority. And CRPD is often referred to as what is called paradigm shift, because in the medical model of the past, focus was too often on impairments. So he or she can't walk, can't see, can't hear, and everything. But CRPD employed social model, and it considers disabilities as the results of the interaction between impairments and barriers. So a variety of societal barriers are considered to be causes of disability rather than impairments alone. And the social model pursues addressing and getting rid of these societal barriers to achieve the inclusion and full participation of all. So let's not just focus on the fact that this person can't walk. Let's focus on the unnecessary stairs which need to be replaced with more accessible formats, such as slopes. And I'd also like to highlight that CRPD considers barriers to be both physical and attitudinal. So the barriers are not necessarily the lack of slopes, elevators, and other physical challenges, but also stigma, prejudices, and discrimination. And those attitudinal barriers may be especially serious for persons with invisible disabilities, including persons with mental health conditions or psychosocial disabilities, and persons with intellectual disabilities. And yes, SDGs. So as we all know, transforming our world and SDGs, this has 17 goals and 169 targets. And this is the international community's pledge to collectively make the world better and more sustainable by 2030. And the key principle is to leave no one behind. And obviously, we must not leave persons with disabilities behind. And so SDGs did not appear all of a sudden. SDGs is the result of various discussions, including the discussions in the field of disability. And the process of formulating SDGs prior to its adoption in 2015 makes it very clear that it is well informed by the principle of CRPD. So for example, high-level meeting on disability and development was convened in 2013, and heads of states and governments discussed the way forward, a disability inclusive development agenda towards 2015 and beyond. And the outcome document was adopted by the resolution of UN General Assembly, and UNGA resolution clearly underscores the importance of ensuring accessibility for and the inclusion of persons with disabilities in all aspects of development. And it also further encourages the international community to to utilize every opportunity to include disability as a cross-cutting issue in the development agenda. And as crystallization, I would say, of various efforts at all levels, member states adopted the SDGs, including the disability perspective, in an unprecedented way. And goal 4, goal 8, goal 10, goal 11, and 17, these goals all explicitly refer to disability issues. So I mentioned that persons with disability continue to face various challenges and barriers, but the international community makes some important efforts. So in order for us to scale up and accelerate our efforts to I would say to realize the vision which CRPD envisions, the following proposals may be worth considering. So number one, constructive partnership with respect for different ideas and opinions as part of diversity. So this is easy to say, but maybe a bit challenging to achieve. So since the adoption of CRPD and SDGs, an increasing number of new stakeholders have joined the community, which is of course commendable and which is of course great. And this often brings innovative solutions and bigger reach to more persons with disabilities. But at the same time, though, not everybody shares the same opinion, not everybody has the same background. And although they share the same idea that we need to achieve inclusion, we need to include persons with disabilities, sometimes confusion and discordance may happen. So to make the partnership work more effectively and efficiently, mutual support is critical. Number two, it is imperative to understand that not everybody is raising their voices. So a large number of persons with disabilities may remain silent out of fear that they may become a target of discrimination or stigma. And so it is really important for us to create a safe environment where all the persons with disabilities can feel safe and comfortable expressing their views or safely be heard. And in this regard, inviting prominent figures or celebrities with or without disabilities to share their personal stories on overcoming stigma and discrimination may be helpful. And in one of the meetings, in one of the high-level meetings which I participated in the UN headquarters, the mother of Lady Gaga, she was invited to participate in a conference led by WHO, and it was highly inspirational. So it may be a great idea. And finally, mental health and well-being of persons with disabilities needs to be incorporated and integrated into disability policies on all levels. You know, they may be at greater risk of psychological distress for a big reason, and therefore providing appropriate support for their mental health is important to ensure quality of life for all. So thank you for listening, and I hope my short presentation was somehow helpful to understand disability rights in the global context. Thank you.
Well, thank you, Jyn, very much for helping us see and understand the social model and the relationship to the SDGs, and in particular, your way of articulating the way forward involving understanding that barriers aren't only physical, but they're attitudinal as well. Much appreciation. Thank you. Our fourth and final speaker is Brigitte Curry. Brigitte is an associate professor in the psychiatry department at the Faculty of Medicine at the American University of Beirut. So she comes to us from Beirut, where it is evening. Her research focuses on issues related to sexuality, diagnostic classification, refugee health, and psychology across international settings. She is a consultant for several NGOs, UN bodies, and the founding president of the Lebanese Psychological Association. Dr. Curry is the immediate past president of the American Psychological Association's International Division. She's vice president of the Arab Union of Psychological Science and a member of the executive committee of the International Union of Psychological Science. She's first author of a chapter titled From Refugees to Immigrants, the Role of Psychology in the Struggle for Human Rights in the Cambridge Handbook of Psychology and Human Rights. Brigitte, you have the floor.
Thank you, Neil, and thank you for the invitation to join such an impressive panel. So I will share my screen and try to, here we go. So let me just go to the slideshow. Okay. So, so I'm going to continue the segue that actually Jyn started, which is talking about another vulnerable group that suffers pretty much a lot from the time they leave their home country until their resettlement. So I will talk about refugees and then they transfer to being immigrants and the challenges that they face. So how do refugees become refugees? Most of the time, the problems start, of course, in the home country. And refugees, as we know, they often come from countries with wars, with insecurities, with distress and violence, no safety. So there's injustice already in the home country. There's violence, lack of safety, lack of basic needs, of course, as the problem continues. And it mostly hits lower to middle socioeconomic groups. And we have seen it through refugees from all over the world. I'm citing a few from Iraq, Syria, lately Afghanistan. The pictures, I think, were very, very strong and remain in our memory. Rwanda, Nigeria, pretty much from all over the world. Wherever there is wars, violence, injustice, you have refugees. Now, a small difference between refugees and the exiled, and I have seen it with Syrian refugees who came to Lebanon, those who have education have opportunities. So the doctors who came from Syria to Lebanon, for example, they worked with NGOs, with the various hospitals, and within 2 to 3 months, they were resettled in their country of choice, mostly in the West, Germany, England, America, Canada, Australia. So these, we cannot consider they are part of the refugee population that we know and we deal with, because they were offered jobs, opportunities due to their education, and more or less their lifestyle did not really change, and they continued, you know, to have a decent life with the rights and everything they need and all their needs met when they moved to their settlement country. So the refugee road, unfortunately, is not that straightforward. So between the home country, they move into transition countries. And Lebanon has been a transition country to many refugees. The most recent have been the Syrian ones. Again, there's discrimination and injustice faced from the host community. Although the basic needs are provided through NGOs and sometimes government, and many services are provided, health, mental health, education, there is a resistance to permanence because the refugees who are in transition countries do not want to resettle there. So there is a resistance to have permanent housing, permanent jobs, permanent schools. Unfortunately, the resistance to this permanence and this transition can take years, and we have seen it with so many refugees. Many of them who have been in Lebanon since 2011, 10 years later, they're still here, still waiting to get their papers to be resettled, mostly in Western countries. And this is what we call the continuous waithood, is that they keep waiting forever sometimes, and again, trying not to settle in a country they do not want to be into and are in transition. So during the COVID-19, I will give Lebanon as an example. It hit the refugee population on so many levels. Of course, it hit all the societies and communities, but the refugees in particular were impacted on many levels. They were among the last people to get tested. If there were symptoms, I mean, like in every community, they say, you know, as soon as you have any of these symptoms, you immediately get tested. With refugees, it wasn't the case at all. And there was a big fear that actually there would be, that the pandemic would spread a lot in the refugee settlements. Quarantining was almost impossible. How can you quarantine and be isolated in a small apartment or in a tent that houses 5, 6 families? So already the requirements for a prevention from COVID-19 was impossible. There were also little awareness efforts done for the refugee community. It was part of a bigger campaign done nationally, but nothing or very little focused for them. Although they were given masks, gels, disinfectant, again, it wasn't easily accessible, not as much as they needed. And of course, if they couldn't afford to buy them. Now, what was interesting was that the services they were provided through the NGOs stopped due to social distancing. we were doing a study on refugees during that period, and I was contacting NGOs, and all of them said, no, we're not going anymore to the refugees. We're providing very few services. Maybe we send once or twice a week, whatever they need, but everything has stopped. The activities, whatever they were given to them has stopped. And in terms of vaccination, the refugees were the last group to actually be offered the vaccines for many reasons. Some were not legally registered. They came in illegally, or they came in legally but did not want to register with the UNHCR. Some were scared. Some were not convinced about the vaccine. So the number, and I don't have the exact numbers, but the percentage of the population of the refugees vaccinated is very, very little. Already our population, we have maybe 20% vaccinated. So it's still a challenge to get people in and get the vaccine. Now, when they arrive to the host country, now the journey already in itself is traumatic and tedious, assuming it is legal. If it's illegal, it's even 10 times worse. They arrive to the host country, and again, the discrimination and the inequity is there. They are the refugee groups, and we've seen it all over the world, Europe, the US. Some countries were better than others, but in general, it hasn't been they haven't been received with open arms. On the contrary, a lot of times they made access to the host country they wanted very difficult. The other thing is that they are all put in one group with similar needs, which is not true, of course. Many of the refugees are skilled. They have degrees or they have skills that they performed very well in their countries. They're educated. And a lot of times they're forgotten because these are the people in the host countries they can capitalize on to actually be integrated and help and be the mediators between the government or NGOs and the other refugees. Often also during resettlement, the families are staying together, but the social relations or acquaintances, the communities are separated. And most of them, they come from interdependent countries where the nuclear family is only one support system versus the extended family and even the neighbors, the friends, the social relations. Most of the time they are separated, which decreases again their ability to adapt. Now, once they become immigrants, there's a lot of forced integration into the host country and expected very quickly, learning the language, the values, the norms, the religion, adapting, leaving, or taking or not practicing it, or practicing it in hiding. So a lot of this is expected from them very quickly. And once they become immigrants, they have less services than refugees because the NGOs don't serve immigrants. Now they have more rights because they're immigrants, hence citizens, but the services are less. And there are also more expectations to find jobs, get into schools, universities, basically settle in a normal quote unquote life. In the meantime, they're grieving their home country. They try to keep ties with friends or families left behind. And they try to find a balance between this identity from the old into the new country. And a lot of times it causes a lot of problems and a lot of ambivalence in terms of their own identity. Then another dilemma becomes apparent is raising the future generations. And I'm going to give you the example of Larry Gul, who's a 21-year-old Turkish-Dutch young woman who wrote a book about her she was born and raised in Holland. She wrote a book about being raised by her Turkish parents in a Turkish family, in a Turkish community, very conservative, not very open and not accepting a lot of the values and the norms of the Dutch. Yet she is Dutch and she went to Dutch schools, and whenever she wanted to start dating or start having a bit more freedom, the community frowned upon her a lot. Now Lara Gul is actually under threat. She has been put in under safety with the police, like in a protection program, because her community were threatening her. And we've seen it many, many times in many countries in Europe where you have the first generation of immigrants who want to be fully adapted or by nature, by just being there and being born there, are that community or that host community, but their parents and the country where they came from pulls them back. So how about science? So the science of refugee integration is a European concept that was proposed by Dr. Dominic Hengartner from Zurich in Switzerland. And he first started saying there is no agreement on the definition of integration. How do we know that refugees have integrated in a country? His definition that he found could be the most comprehensive one is that it is the degree to which immigrants have the knowledge and capacity to build a successful and fulfilling life in the host society. Very big definition, very broad definition that tackles many, many, many aspects of integration. The economic aspect, securing job for financial security. The linguistic aspect, that's the most important, learning the language of a country to communicate. Those of you who tried learning foreign languages, I can tell you it's difficult, especially as you get older. The psychological integration of adapting, growing, and being happy and satisfied in the host country. The political integration, learning about governance, leadership, possibly getting involved in voting and advocacy, even in running, and we've seen it in certain European countries where immigrants have run for office and won and represent so well their immigrants and refugees coming in. The social integration, establishing relations, and then what he called the navigational integration, which is knowing how to function in a daily life, which again is not easy. So all these are part of integration. And he spoke of an integration window, which I think is very interesting. He said that the sooner an asylum seeker can escape the legal limbo of waiting for a decision on their status and resume a normal life, the sooner they are able to contribute to society. And he gave 2 years as the crucial window through which refugees can become immigrants, and immigrants can become settled in their new citizenship. So the earlier the integration, the more positive effects they will have and settling into their new life will have. The further or the longest the integration action takes in terms of deciding on their status, then the more negative effects they will have. And he created an algorithm, of course, saying that not all refugees are the same. And sometimes we think it's obvious. One of the things he said is language. For example, people who speak French would be better as a second language in French communities in Switzerland versus being in a German one, for example. People who have similar religions, people who come from rural areas will settle better in also rural areas in their new host countries. So he made this algorithm whereby several variables are taken into account to generate a best place for resettlement. Asylum policies, most of the time, are not focused on integration, but rather they want to reject as many applications as possible. And we have seen it every day. So measuring integration and being able to help government to tell them, this is what will help, this is what will be an integration, a success in integrating refugees. These are the variables, these are the programs and the interventions that will make it successful and as early as possible. And this is where relying on science and data will be very important and will be a support, I think, for governments to be able to help the refugees coming in and having them be part of a positive force in the society and in their communities. So I'm going to take the SDG number 3, which is health and well-being, since we talk about mental health and I'm an expert on that. So can we have health? Can there be health, including mental health, without having equity, without having social justice or human rights? Or is it a relative issue? Is it a matter of time? They will get healthier as they stay longer, according to the algorithm, not really. And the other thing is that why don't governments and NGOs rely on data from refugee science? Why are the same mistakes repeated? And I can tell you that in many of the programs that refugees follow or are applied or offered to them as interventions, very few are actually tested or researched. We don't even know if something as basic as psychological first aid actually works when it is given to refugees. So I will leave you with these questions, and I'm looking forward to our discussion once we start with the breakout rooms. Dr. Rubin, the floor is yours again.
Okay, thank you so much, Dr. Corey. And thank you for your perspectives on refugees. And you know, though this may sound odd, it's so helpful in the US for us to be reminded that this is a global issue. We're so focused on a particular issue at our southern border that we forget our connections around the world and how we're not the only ones dealing with this, that there's a lot to learn from what people have experienced all over, and certainly including, as you've described, in the Middle East. Okay, so in terms of our time, we have a little bit of time. We had wanted to hear from our participants and have you engage with our speakers. And we had in mind to have two small breakout groups. The first will be with Art and with Brigitte, so representing Indigenous communities and refugees. And the second group will be with Roseanne and with Jyn. Again, Roseanne, environmental justice and the African diaspora, and Jyn with barriers for the disability community. Okay, and Josh, how will we have people, our participants, joining the groups? And then we will have about 10 minutes. We'll come back, bring us back at 10 after the hour for final comments and results of the discussion in the groups. Okay, I'm in the interest of time, I realize I gave you an awful lot to do with a very short time, and there really isn't time to get into all of what you discussed, but I'm happy that we had at least a brief amount of time to hear from you and to hear your ideas and your contributions. It adds to the richness of our learning experience in having the chance to present with you today. So I'm just going to, because of the time, I'm just going to conclude here by expressing my appreciation and all of our appreciation to AAAS, to Teresa Harris, to Nate Weisenberg for organizing the conference, the Human Rights Coalition, which is doing such wonderful work on behalf of so many scientific organizations for this opportunity. Thank all of you that have joined us. We really value having the chance to interact with you. All of our contact information, will be available through the organizers. And if you want to get in touch and have further discussions or information to share with any of the speakers, please do. We'd love to hear from you. We really value that. And I guess last, before I close, I want to thank Josh from AVEX, our tech god, for making this all work. We really appreciate your attentiveness to our needs. So I hope everyone continues to have a great conference, have a great day today, and we look forward to hearing with you in the future. Thank you very much. Bye-bye.
Thank you. Bye.
Thank you. Thank you,
Bye-bye.
everybody. Bye.
Thank you. Thank you.